Nowadays, we see so many women complaining of excessive, unwanted hair over their face and other parts of the body. And this condition, in a medical language, we call it as a hirsutism. Do you know that what is this hirsutism? Why does it happen? And what are the symptoms when you have a hirsutism? How do we diagnose that and how do we treat it? If you don't know, then stay tuned with me because we are going to discuss that in today's topic. Namaste. My name is Dr. Tanvi Mayur Patel. I am an endocrinologist, a hormone specialist doctor from Mumbai, India. Now before I begin this video, one important information. If you want to watch this video in Hindi language, then on the I button and in the description box there is a link. If you click on that link, then this video will be played in Hindi language for you. अगर आप इस वीडियो को हिंदी भाषा में देखना चाहते हैं तो ऊपर आई बटन पे और नीचे डिस्क्रिप्शन बॉक्स में एक लिंक है. अगर आप उस लिंक पे क्लिक करेंगे तो इस वीडियो को आप हिंदी भाषा में पाएंगे. So let's talk about a very common hormonal problem and that's called as a hirsutism. Well, it is actually a medical term. So how do we pronounce it? That is hirsutism. Now what is this medical condition? Hirsutism is nothing but a condition wherein you have a excessive and unwanted hair which are very thick, very coarse, very darkly pigmented over those areas of your body which usually present in men. So in fact, women ideally should not have a hair over their face, especially on their upper lips, side locks, chin area and many other body areas like your chest, then your abdomen, upper back. So these are the places when you have a excessive and unwanted hair like a men have. This is called as a hirsutism. Please do not worry, this condition is a very common condition. In fact, 5 to 10% of women who are in the reproductive age group, they have this medical condition. Now, the moment we talk about the hirsutism, the very first question in a woman's mind is that, is it normal to have a hair over your face? Answer is yes. See, all of us have some or the other amount of a facial hair. However, this facial hair, which are called as a vellus hair, or in a layman language, many people call it as a peach fuzz. Now, this hair are very soft, very translucent, and they are not very deeply pigmented. So this hair, presence of a peach fuzz of a hair over our face and other parts of the body is a very common. In fact, this hair is considered a very important for us to maintain our body temperature. But what happens when this hair comes in a contact with a higher level of the male sex hormone, that is an androgen, this fine hair becomes very thick, coarse, and this deeply pigmented hair turns into a second category of a hair, what we call it as a terminal hair. So when a person has an excessive, deeply pigmented, thick terminal hair is nothing but a hirsutism. So as I told you earlier, few amount of a hair over your face is very much normal. Now, many a times and many people, especially the women, have a lot of hair over their entire body which are of a Vellus category, and this condition is called as a hypertrichosis. Hypertrichosis is a separate entity altogether. Today what we are going to talk, hirsutism is not a normal condition. In fact, it is a pathological or a medically wrong condition. A hirsutism indicates that there is some kind of a medical hormonal problem is going on inside your body, and that's what you need to fix to get a solution for the hirsutism. Now let's find out what causes this hirsutism. See, hirsutism is caused by mainly two reasons. One, either your body has an excess of a male androgen hormone, or second condition that the male androgen hormone level is normal, but still your body's hair follicle has a higher sensitivity to this normal level of androgen hormone. Even that can cause a hirsutism. So that means it is caused by either the excess of hormone or excess of the hormonal sensitivity. Both of these conditions can cause a hirsutism. See, technically speaking, any condition which can increase the androgen level can have a potential to give you the hirsutism. So what is an androgen? See, androgen is nothing but a male sex hormone, and mainly it is a testosterone hormone. Though testosterone is a predominantly and a larger amount found in the men, it does not mean that testosterone is not present in a women. Androgen hormone are also present in a women, and this androgen hormone in a women comes from two body areas. First, it comes from the ovary, and the second, it comes from an adrenal gland which is located on top of our kidney. So both of these glands produce the androgen hormone. So whenever the level of the androgen hormone increases, you have a tendency of getting the hirsutism. So if we talk about the ovary problem, then two conditions can give you the hirsutism. First, if you have a very common condition called as a polycystic ovarian syndrome, what we call it as a PCOS. So if you have a PCOS, you have a hirsutism, and in fact PCOS is one of the most common reason for the hirsutism. So PCOS is nothing but a condition wherein your ovaries has a many small immature follicles, and because of that you might have a irregular periods, you might have a weight gain or difficulty in losing weight, you might have an insulin resistance leading into acanthosis nigricans, you might have a acne, you might have a hair fall. So this can be present if you have a PCOS. Second ovarian condition is the ovarian tumor or a cancer which is making lot of androgenic hormone. So that has the ovarian issues. Now we talk about the issues which come from the adrenal gland. So adrenal gland issues are usually relatively less common compared to the ovarian problem. But adrenal issues, first is the Cushing syndrome. Now Cushing syndrome is an endocrine health problem wherein your adrenal gland is producing large quantity of a cortisol hormone, and that can lead you into hirsutism. Second condition is called as a congenital adrenal hyperplasia. Now this condition is present since childhood. However, it comes into the notice only in the adolescence or later in the adolescence. And this condition is usually inherited and it runs in the family. And again in congenital adrenal hyperplasia, you have a higher amount of the cortisol and other androgenic hormones. And the third condition is the adrenal tumors. So if you have any kind of a adrenal tumor which secretes lot of androgen, again you have a higher chances of having a hirsutism. So we saw the causes which are pertaining to the ovary and we saw the causes pertaining to the adrenal gland. Besides this, there are certain even medications which can give you the hirsutism. So the medicines are steroid. When you use a steroid for a long period of time, you have a hirsutism. Then a medicine used like a danazol. This medicine is usually prescribed for a uterine condition called as an endometriosis. Then a minoxidil, which is a very commonly used medicine to treat the alopecia or a balding. Then there are certain medications like phenytoin. All these medicines can also give you the complications of the hirsutism. Another condition is a menopause. Now menopause is nothing but a complete stoppage of the menstrual periods. When you have a menopause, the estrogen level hormone decreases, and because of the fall of this estrogen, which is a feminine hormone, there is a relative increase in the male hormone androgen, and this imbalance of the estrogen and androgen can also lead you into hirsutism. Another condition is the idiopathic hirsutism, wherein we do not know any cause of the hirsutism, but still you are having a hirsutism. And many a times it is considered that the idiopathic hirsutism is in fact a milder version of the PCOS. So if you have a hirsutism, first of all you need to find out at what is your cause of the hirsutism. See, usually this hirsutism does not happen suddenly. It is usually a gradual process. So you might find one or two hair coming over either your chin or your upper lips or your side locks or other body areas, and this rise is a gradual. However, if you see that suddenly there is a lot of male hormone coming up and lot of hirsutism is increasing, and this sudden is a rise of this excessive hair is of the concern, and in that case you need to contact your nearby endocrinologist doctor immediately, because there might be possibility that sudden rise of the androgen hormone can be from a tumor. And in fact, it is found that when the tumors causes the higher level of the androgen, it causes also other signs of the male virilization. And this male virilization characteristics are like if you find that your voice is changing, or you find that your breast size is decreasing, or suddenly there is an increase in the muscle mass. All these can be a sign of the virilization, and you need to pay attention to. Now let's see who all are more prone to get a hirsutism. See, hirsutism can happen to any women whose weight is high. That means if you are overweight or if you are obese, then you have a higher chances of the hirsutism. Many times, even a positive family history can be the reason. Now, many times what happens, the conditions like a PCOS, then congenital adrenal hyperplasia, they run in the families. So, if your family member has a hirsutism, again you have a higher chances. If we talk about the ethnicity, then the people who are from a Mediterranean, South Asian and Middle Eastern population have a higher chances of hirsutism. So now let's find out, if you have a hirsutism, which doctor you need to see. It's one of the very common question which people ask and people have in their mind. Many times what happens, they have excessive hair, they run here and there, and they don't understand that the problem is not external but the problem is internal. So if you have a hirsutism, you need to visit your nearby endocrinologist or hormone specialist doctor. You can also take a help of a gynecologist doctor, and many times because the hair is present over the face, they also visit to the dermatologist or skin doctor, and then it's a teamwork of all these three doctors which will help you in treating your case. Okay. Another question people have is that, do thyroid problem give you hirsutism? See, ideally thyroid does not give you hirsutism, but if you have along with thyroid maybe a PCOS, or if you are having a weight issues, then yes, it can coexist together. Okay. Now let's find out, how do we diagnose that you have a hirsutism? See, hirsutism is in fact a self-diagnosable problem. Okay. In fact, it is not a disease. Understand, hirsutism is not a disease. Hirsutism is in fact a symptom of a disease. It indicates that there is something wrong going on inside your body. So when a person walks into a doctor's chamber, a person already knows that there is excessive hair. So it is usually a very self-diagnosable condition. However, once you visit to your doctor's chamber, your doctor will do a further investigations to find out the cause of the hirsutism. So in that very first, we do your blood test. In the blood test, we want to know about your insulin level, your sugar level. We also want to check what are your level of your androgenic hormone. Do you have an excess of the male hormone like a testosterone? Your doctor might ask you to do other testing like a DHT, SHBG, 17-OHP. These are the certain tests which we also ask. Of course, based on your medical case, your doctor might ask you to do a thyroid function test and other hormonal parameters like a prolactin also. HbA1c can also be advised to find out the sugar imbalance. So all these hormonal blood test is done. Okay. After that, if we suspect that you have a PCOS, we might ask you to get an ultrasound done of your pelvis, wherein we are going to scan your ovaries to find out are there any immature many follicles. So that can also indicate a PCOS. Okay. And if your doctor is suspecting any kind of ovary or adrenal tumor, in that kind of a situation, you might be asked to do a scan like a CT scan. Again, it is a person to person, so your case to case dependent it is. But usually these are the testing which we routinely ask, and of course as the case varies, the plus minuses of the investigations can happen. Okay. Now, once the diagnosis is done, then the next question comes is the treatment. Okay. So, a treatment is usually divided into two classes. Okay. First is a treatment which we are going to talk about the medication, and the second is a more of a cosmetic treatment. So when we talk about the medical treatment, so first of all we try to find out that what is your cause, and based on that we try to balance out. So if you have an increased level of the insulin, your doctor might ask you to do a good lifestyle change, wherein you have to do a good amount of at least 60 minutes a day or at minimum 5 days a week of an exercise, and you have to work up on your diet also. When you do this good dietary and a lifestyle and a physical activity, you will experience a lot of improvement in your hirsutism, and you will also find that your insulin and a sugar level also comes in the balance. Sometimes we also prescribe you a medication like a metformin or a pioglitazone, which are considered as a insulin sensitizers. Understand one thing, that when you have an excess level of the insulin, this condition leads into insulin resistance, and when you have an insulin resistance, itself can trigger ovaries to make more androgen hormone, and higher level of insulin also increases insulin like growth factors like IGF-1, which also triggers the androgen production. So when we reduce your insulin level, again we find a lot of improvement, and for that we take a help of a metformin and pioglitazone, which are insulin sensitizer medications. Okay. Second medicine what we use is a oral contraceptive pills. Now oral contraceptive pills, they contain the estrogen and progestin. So oral contraceptive pills, of course you need to take it in a cyclical form, and this oral contraceptive pills also reduces hirsutism to a major extent. Along with the oral contraceptive pills, we also take a help of an anti-androgenic hormone medications, and they are also called as an androgen blocker. As the name suggests, these medicines, they block the activity of the androgenic hormone. And in that, the very routinely prescribed medicines are like spironolactone, then we have finasteride and flutamide. But mind you, if you are planning for a pregnancy, in that case you need to speak to your doctor, because anti-androgenic hormonal medications may not be suitable for you, and in fact it can give you a lot of congenital problem. So if you are planning for pregnancy, do speak to your doctor, and based on that you take the medication. So these are the conventional medications. Okay. Another question a women usually ask, doctor, is there any cream which I can apply on my face so I can get rid of this hirsutism? Answer is yes. See, there is a cream called as a eflornithine cream, which is usually applied twice in a day over the areas where you have a hirsutism. However, understand this cream does not work at internal level. This cream results are only temporary, and the results last till the time you take the application of the cream. The moment you stop this cream, again you will experience that the hair again coming back. So it is always advisable that you work internally balancing your hormones also. Also, this topical cream is usually advised along with the other treatment methods to treat the hirsutism. But yes, there is a cream available. Okay. Now talking about the cosmetic treatment. Now this is very, very important, because these hair are present over the face and it ruins the beauty of a woman. So the cosmetic treatment is the first and a foremost reason why a woman is seeking for the treatment. So in the cosmetic treatment, you can take a help of the methods, conventional methods like a plucking. Now plucking, you can do it with the help of a tweezer. However, the problem with the plucking is that you will have to do repetitively, and plucking can be used only for a few hair. If you have a larger body area where you have lot of hirsutism, then plucking may not be the right for you. Okay. Also, plucking can be a painful to many people also. Second is a shaving. Shaving is a very quick, very reliable, and it is not very expensive as well. Again, shaving you can do very frequently. Okay. So that can also be done. And with this, people have a myth that if you shave more, there is a higher chances of having a more growth. However, it's not very, very correct statement. In fact, in scientific evidences, it is found that shaving does not increase the volume or the quantity of the hirsutism. So you can use a shaving also. Another method is using a waxing. So waxing, again, it can be painful. Again, you have to do repetitively. Alright. Another way of doing cosmetic treatment is a bleaching. Now when you use a bleaching method, it does not remove the hair. What it does, it lightens the hair so that it is not visible to other people. Okay. But again, this bleach contains a compound like an hydrogen peroxide, and many people might be allergic to it. So if you are using a bleaching method, then do a patch test before you do this method. Okay. Another cosmetic treatment is using the hair removal cream, which we call it as a depilating creams. So this hair removal creams, the problem with these creams is again that repeated applications is needed, and many a times many people have an allergy and they develop a skin irritation and a dermatitis. So again a patch test is advisable. So these are the cosmetic ways you have to do the treatment. Besides that, the medical cosmetic treatment available are two, in that the first one is the electrolysis. Electrolysis is nowadays not very preferred, and we have a other better advanced treatment, and that is the lasers. Yes, lasers are usually done in a skin doctor's clinic, and the lasers are quite effective. I will make another video wherein we are going to talk about the lasers for the treatment of the hirsutism. But yes, lasers is also one of the reliable treatment option. Okay, whatever treatment option topically you choose, but always understand that the problem is an internal hormonal imbalance. So you need to work up on the internal balancing of your hormones also. Okay. Another question the women usually have is that, doctor, how long will it take for me to get rid of this hair? See, when it comes to hirsutism treatment, patience is very important. You have to have a patience of minimum 6 to 12 months so that the results show beautifully on your face. Till that time, you can take a help of a topical or cosmetic treatment like a waxing or shaving and plucking and all those methods which I just now told you. But yes, internally the balancing of the hormones will take time. And also the hair follicle cycle is also long. So you will have to develop a patience, and that is very important. Again, a very common question of a woman is that, doctor, will this problem will go away completely? See, answer is in a gray zone actually. Okay, many a times when you combine all these treatment methods, a lot of women find a huge improvement in their body condition, and they find that the hirsutism is treated to a very larger extent. Again, however, it depends on case to case also. Okay, now talking about the prognosis, will it cause any other problem? See, as I told you earlier, that hirsutism, it is not only just the external appearance. The prognosis is, in fact, with the treatment is very good. However, what happens is that when a woman has this excess of her hair over their face, it reduces and it somehow diminishes their confidence. The women lose their confidence, and many a times the women go into a depression zone. They don't want to meet people, they don't want to go out. Okay, and this leads into further mental and a psychological problem. So that leads you in fact into the complication. So please, my advice to every woman who is fighting with the hirsutism is, do not lose your confidence. It is a medical condition and it is a treatable condition. Okay, so if you have the problem, there is a solution for that. Okay, so first of all, you need to accept yourself. You need to accept your body, that there are the problems and we are going to work upon that. Besides that, yes, you need to work upon your lifestyle. As I told you, you need to work upon your diet and you need to work upon your exercise. By the way, what kind of a diet you need to take if you have PCOS, do watch my other video wherein I am talking in detail about that. Okay, so you will get an in-depth knowledge about what to eat and what not to eat when you have a PCOS problem. So if you focus on all these elements, you will find there's a lot of improvement. Okay, PCOS itself will not lead you into a direct problem, but yes, if your weight is increasing, you will have a higher chances of having a sugar imbalance, and it is found that the women who have PCOS also have a higher chances of developing type 2 diabetes. Okay, and if your periods are irregular, and then in that case after marriage you might have issues conceiving. Please remember, external treatment will give you result only if you work up internally. Alright, I hope after watching this video you got some good useful information. And if you are new to my channel, please don't forget to subscribe so that you get more and more health related information, especially thyroid, diabetes, PCOS, obesity. And if you have any of your personal question whose answer you are seeking for, please write your question below in the comment box. I try to read and answer them as early as I can. And then there is a bell icon. If you click there, as and when my new video will be published, you will get an instant notification so you don't miss out on any important information. Thank you for joining me till now, and I wish you a great health. Namaste.